Welcome to Raaonline. Okay, so today we have a very important trial, Coact trial. Whenever we start with the trial, we'll have a question to discuss. Okay, if that question is clinically significant and relevant, then we'll take over the trial and we'll just see what this trial tells us. And moreover, we are not just sticking to what is the outcome of this trial. We need to know whether the trial was conducted properly, and can it be a good internal validity, external validity, and so that you can apply it in your clinical workup. And moreover, what is the weakness of the study and what is the strengths of the trial. Okay, so now we have this Coact trial. This is nothing but the coronary angiography after cardiac arrest without ST segment elevation. Okay, so a brilliant question. So this is being asked in DNB Emergency Medicine year 2021, paper 4, question 8, Coact trial. Okay, so we are taking this class not just because this is a previous year question. This is because the team has felt that emergency physicians and the intensivist or the medicine doctor in a whole should be aware of this trial. Okay, this is very important for your clinical practice. Okay, so the question is that you receive a patient having a in a cardiac arrest state. Okay, it's an out of hospital cardiac arrest and they have resuscitated the patient, ROSE is obtained and the patient is reaching your hospital, right? So this group of patient, will you ask your cardiologist to perform angiography immediately or later? So this is a question. Okay, sounds a very most common question in our real-time practice, right? So we always urge our cardiologist to do a angiogram immediately whenever you see a cardiac arrest patient because of cardiac cause, right? So let us see what this trial specifically searches and what this trial has come out with an answer. So in adult patients who have sustained an out of hospital arrhythmia associated cardiac arrest, okay, without ST elevation myocardial infarction, very important. Okay, look at the clinical question. They are not speaking about STEMI. Okay, STEMI, it's crystal clear that you need to do an angiogram, put a stent in there if possible. Okay, so we are looking into conditions where it is without an ST segment elevation. Okay, so out of hospital arrhythmia associated cardiac arrest without an ST elevation myocardial infarction. Okay, immediate angiography superior to delayed angiography in improving 90-day mortality or 90-day survival, I can tell you. Okay, so this is a question, very relevant question, and every emergency physician and intensivist need to know this. So background is that we all know that percutaneous coronary intervention has been shown to improve mortality in patients with STEMI, right? And the benefit of early angiogram in post-cardiac arrest patient with a non-STEMI or N-STEMI is uncertain. We don't have any clinical data, right? But there are some observational studies suggested that early intervention may provide a survival benefit. Okay, so this forms the basis of a question, okay, of this trial. So and we know that incidence of CAD, that coronary artery disease, is high in this group of patients. Okay, but when they were taken up for thrombolysis directly, it did not give a good outcome. We know that the incidence of CAD is high, but thrombolysis is not helping them. Okay, so this is where the doubt comes, right? So why to do a thrombolysis? Do an angiogram to see exactly what's inside. Okay, so this is the first randomized controlled trial as early angiography in patients who have an out of hospital cardiac arrest without STEMI. Very important. Okay, very significant question and very interesting question also. Let us see how they have did this trial. Can it be relevant to our real-time practice and can we reflect this in our clinical decision making? Okay.